Hi friends, welcome to Interactive Medicine. In this section, we can talk about shock. Shock is characterized by vascular collapse and widespread hypoperfusion of cells and tissue due to some reasons. In vascular collapse means a sudden fall in blood flow, and perfusion means entry of nutrients and oxygen. So, blood supplies the oxygen and nutrients to cells, and the shock is due to decrease in blood volume, decrease in cardiac output, and decrease in vascular tone. Decrease in blood volume we can see in hypovolemic shock. The normal blood volume, the blood is lost, and decrease in blood volume leads to insufficient oxygen and nutrients for cells. It is can due to hemorrhage, due to accidents or massive injury, and severe dehydration and fluid loss secondary to severe burns. In decrease in cardiac output, I draw a heart, left ventricle, and the aorta supplies the blood to tissues. If decrease in cardiac output, it leads to decrease in perfusion to cells. It leads to hypoxemia and death. Can seen in myocardial ischemia. It is the lack of blood supply to the muscle leads to its destruction. Heart muscle did not get enough oxygen and it leads to the infarction because of some clots are in present in coronary arteries. We can see in cardiac arrhythmias also decrease in cardiac output, and in pulmonary embolism, any emboli, for example, clot can increase the uh, right ventricular dilation. So heart need to do more work, but no use. Pulmonary vein cannot supply oxygenated blood to heart. It leads to hypoxemia and death. Then cardiac tamponade is as another example. This is the fluid present between the heart muscle and the pericardium. So heart need to do more work to pump the blood. You can see this in decrease in cardiac output, and it leads to cardiogenic shock. Decrease in blood volume can seen in hypovolemic shock, and decrease in cardiac output can seen in cardiogenic shock. So decrease in vascular tone in septic shock, neurogenic shocks, and anaphylactic shocks. So first we can talk about septic shock. Septic shock due to viral or bacterial infection. It causes the triggering of the cytokine release, and cytokines triggers the vasodilation and hypoperfusion, and acute respiratory syndrome or ARDS, and disseminated intravascular coagulation or DIC, then multiple organ dysfunction syndrome or MODS. The mortality rate in this condition is 20%. The second one is neurogenic shock, which means the shock originated from nervous system, and it is a generalized vasodilation. It can so it is activated by parasympathetic or inhibition of the sympathetic system, and leads to massive vasodilation. It can see in anesthesia and spinal cord injuries. Third one is anaphylactic shock. It is a general vasodilation and blood vessel dilation due to chemical mediators like, for example, histamine. It is associated with the hypersensitivity reaction 1. So in conclusion, decrease in blood volume, decrease in cardiac output, and decrease in vascular tone leads to hyperperfusion, that is decrease the entry of oxygen nutrients into the cells due to sudden vascular collapse, which means that decrease in blood flow rate, sudden decrease in blood flow rate. So the stages of shock is: first one, compensation. Perfusion to vital organs is mediated by or maintained by reflex mechanism. Compensation is characterized by increasing in sympathetic tone, release of catecholamines, and activation of RAS. For catecholamine, for example, adrenaline. In RAS, we can see in increased water uptake and increased blood vessel constriction. So if it fails, decompensation can happen. There is a progressive decrease in tissue perfusion, leading to potentially reversible tissue injury with the development of a metabolic acidosis or lactic acidosis. Decreasing blood flow to tissue leads to hypoxia, and it leads to the anaerobic reaction, and it leads to lactic acid accumulation. And third one is electrolyte imbalance and renal insufficiency. And the stage 3 is irreversible tissue injury and organ failure. It results ultimately into death. The organs show various manifestations of shock in kidney, in lungs and intestine. In kidney, show fibrin thrombi in glomeruli, and ultimately acute tubular failure ensures, which causes oliguria and electrolyte imbalance. Lungs undergo diffuse alveolar damage known as shock lung. We can see alveolar edema and interstitial edema. Lungs have a dual blood supply, generally not affected by hypovolemic shock, but in septic shock, we can see shock lung. It is associated with the ARDS, and the final process of inflammation is healing or fibrosis. You can see the alveolar septa is thickened here, thickened alveolar septa, and exudation will release interstitial fluid. We can see an alveolar edema we can see in lung shock. In intestine shows superficial mucosal ischemic necrosis and hemorrhages with prolonged injury. Bacteria may ensure, and I draw here the mucosal membrane, and here is the ischemia and necrosis happen. In hemorrhage, prolonged injury and bacteria may occur. So finally we can conclude the summary. Shock, it's due to vascular collapse and hypoperfusion. It leads to decrease, it is due to decrease in blood volume. In hypovolemic shock, decreasing cardiac output. In cardiogenic shock, decreasing vascular tone. We can see in septic shock, neurogenic shock, and anaphylactic shock. The stages of these are compensation, decompensation, and the irreversible cell injury. It leads to death. Shock manifests in organs like kidney, lungs, intestine. Kidney, we can see oliguria and electrolyte imbalance. Lungs, shock lung. Intestine, mucosal necrosis and hemorrhage, and also bacteremia. Okay friends, thank you.